Hi all, my name is Irene Mosca. I'm an assistant professor in the Department of Economics and I'll be your instructor in Health Economics, EC329, which is a third year elective. And as you can see here, that's the textbook I'll be using. It's the book by Bhattacharya et al. And it's a textbook which is used very widely across the world. It's used in many departments and we have it in the library both as a textbook as an ebook. Health economics is a lively field where we study real-life decisions. For example, why people smoke, although they know it is bad for them, or why having health insurance might make people less healthy. And why is health economics interesting? I think there are at least three characteristics that make health economics interesting. The first one is that the healthcare economy is massive and expensive, and this is true in the US, but not only. It's also true in many countries around the world, including Ireland. The second characteristic is that governments around the world are deeply involved in financing health systems. And the third characteristic is that health is a major source of uncertainty and risk. And today I'd like to focus a bit more on this third characteristic because it's obviously very important given the COVID-19 pandemic. So why is health uncertain and contagious? Focusing first on uncertainty, we, for example, can say that most people can predict how many TVs they'll buy in the next week, but they cannot predict how many emergency heart surgeries they will need in the next week. Contagiousness, it does not really matter to you if your neighbor buys a TV, but it does matter if, for example, he skips his flu shot. Uncertainty is then related to insurance because we know that most people are risk adverse, so health-related uncertainty motivates individuals to demand and to buy health insurance. This in turn creates problems of adverse selection and moral hazard, which you have probably already investigated in other courses, so you will investigate this year as well in other courses. And these two phenomena, adverse selection and moral hazard, are what make health policy really difficult and also really interesting. Contagiousness is also related to externalities because the fact that other people's health decisions affect you create externalities, and we know there can be both positive and negative externalities. When it comes to health, we can say that, for example, vaccinations create positive externalities, whereas going out in public with COVID-19 virus or symptoms does create negative externalities. And again, as you probably have already seen in other courses, we know that externalities undermine the efficient function of markets and often require government intervention. I'd like to give you some examples of topics that will be covered in EC329 Health Economics. We will focus, for example, on the determinants of demand for health and healthcare. We will focus on demand for health insurance and its determinants. We will focus then on health policies, so we will see how different countries around the world deal basically with the policy when it comes to health. And we will also focus on specific topics like population aging and obesity. Population aging is very important for healthcare system sustainability, and obesity is another very important problem that many countries around the world are facing, so that we're also we've seen the term often of obesity epidemic. This is not a very technical course. There's quite a bit of health involved, and my main aim basically is to introduce you to these health concepts and then obviously link them to economics concepts and economics tools, so you can have a good or even better deep understanding of health economics. So hopefully I'll see you soon. In the meantime, please take care and stay safe.